Farha Abbasi is a clinical assistant professor in the Department of Psychiatry at Michigan State University and core faculty member of the Muslim Studies program. And she's been named a 2024 Healthcare Hero by Crain's Detroit Business. As Ryan Kelly wrote for Crain's, Dr. Abbasi is working through fear, politics, and stigma to treat mental health in Michigan's Muslim, minority, and LGBTQ plus communities while navigating geopolitical events.
First of all, I'm glad they did, because more than who I am as an individual, what I'm trying to do and what I'm representing is that need to be made visible and need to be out there. So I'm really appreciative and honored, of course, to be included.
Take me back first. So when and how did you come to the U.S., and then why MSU? Why are you here, of all places?
So my brother was MSU grad, or did his residency here, and settled here. He worked for Ingham Regional for, by the time he moved, almost 20 years. And so he was the reason that we all decided to come here. My sister went through residency here, and then I joined the residency here.
So what attracted you to MSU, I guess?
First of all, family. But when I came here, I realized in itself the Spartan culture and the environment and welcoming environment for somebody new to the culture. So to me, that's what I was looking for, home away from home, and that's what Michigan State was.
Kind of describe your research and your clinical interest. You know, what gets you up in the morning, gets you fired up?
Sense of responsibility, I would say. The innate mother in me, the need to nurture. And to me, when I started medical school early on, my motto became to care is to cure. I understood there's a place for medication, but there is always the psychosocial factors that always attracted me. So back home, I was more internist. I was practicing as an internist. But when I came here and I realized I was doing my observership here, and I realized that, no, I want to go deeper down. I don't want to say what disease the patient have, but I'm more interested in who the patient is who has the disease. So for me, that, and then I was lucky to connect to psychiatry professor, and she encouraged me to look into psychiatry as an alternative career, like as a second career. And the first day I was at my observership, I was like, my God, this is what I've always been seeking. So, you know, I'm a big follower of Sufism, and it talks about sometimes you find your purpose, and sometimes the purpose finds you.
What do you mean by the color of wellness?
I think when we look at wellness, at the best, what I see is happening, we are looking at it from the lens of equality. We are missing the equity. What the wellness would look for somebody like me versus what the wellness would look for someone who has been born and raised here is very different. First of all, when I am a cultural psychiatrist, and we understand that culture is always you bring where you are born, and you are evolving into where you are today. And what I see is that the part that we always carry within ourselves, the part of where we are born, the belief system, the learned behaviors, you're always looking at the world from that lens. So when we talk about wellness, and if I bring it from the trauma-informed care lens, wellness is you're living your optimum best health So it's not only absence of disease, but also living to the best of your potentials. And what I realized early on, that for people who make America their home, or is America is their home by choice, I say, because you can be born anywhere, but you choose to live somewhere. I realized that how the host culture welcomes you, accepts you, integrates you, can make or break you. So it's very interesting to me that we are an agriculture university. We work with different species of plants. We work with horses, animals, the whole environment. But when we are trying to move one species from one environment to the other, we prepare the host environment. We don't put the onus on the plant or animal that we are bringing in. But with immigration, I think what happens is the day you arrive, you are accepted. Like it's expected that you will be adapting, you would be integrating, not taking in consideration that the soil has to be more accepting and welcoming before anybody can grow roots.
How do you define lifestyle medicine?
Again, it is we have to, right now it's a big thing, taking in consideration social determinants of health. So life medicine is great. We all know you should exercise, you should sleep 8 hours, you should eat healthy. But let's think of this way. What's the price of a box of blueberry? And what's the price of a burger? And if I am coming in with multiple responsibilities, limited income, what is more easy and accessible to me and my kids is that burger. The way our social environment is set up right now, and which breaks my heart, because forever you grow up looking at America as that utopia that has figured it out and gets it. But then you see that the lower socioeconomic status, more prevalence of drugs, more easy accessibility to cigarettes, guns, and there are no more even fresh grocery stores in those zip codes. So if your zip codes start determining your wellness, then we are losing this ethical, moral concept of wellness.
So what are we doing about that to try to address these issues?
Early on, I decided that each one of us can be part of the problem or part of the solution. So I think the responsibility lies with each one of us. And what I'm trying to do is, first of all, I think you go within yourself. You want to discover who you are, what is important to you, and what is your authentic self. And staying true to yourself is important, because sometimes, or most of the times, we have to understand that racism doesn't just exist outside. It's very seeped into the system. It's very integrated and reflected in our policies. So when you are faced with that, I can give you an example. When we talk of identity, for me, my identity is, of course, I'm a woman, I'm Muslim, I am a woman of color, I'm coming from Pakistan, so all those are part of my identity. But if I come into a system and the system tells me, well, I can take your ethnicity, I can accept where you are immigrating from, but maybe I'm not comfortable with your faith, then you are not really accepting me. I would still feel not included. I would still feel rejected. So to me, when we talk of what each one of us need to do, is we do our part, we stay true to our belief systems and stay authentic, but we also have to continue to be visible to stay viable. By that I mean that forever I look at the literature and I see how racism has impacted the minorities in the country, and all forever you would hear, fly under the radar, stay silent, don't bring attention to yourself. Still, that's the first safety rule you teach your kids. Don't bring attention to yourself. I actually from forever wanted to be change that narrative. And I want to be seen, I want to be heard, and I want people to know I'm here. I am part of America. And, I've always say that I'm actually the new face of America. And people better start understanding and accepting that. So I think for each one of us, that piece is very important.
Somewhere I heard moving into mental health a little bit. First, I got to imagine as a psychiatrist, you're thrilled with the attention our mental health has been getting. For a while, COVID, I think, really increased the focus on, which makes so much sense that our mental health is part of our overall health. I think just in general that probably that momentum pleases you.
Or overwhelms me because not all attention is good. So you had a culture where we were very negligent, and now we are over-focused on it, but is it translating enough into funding, into resources, into effective policies? Those, I see huge gaps there. So what is that quotation? That it's like a good policy stitched with bad intentions, or that famous quote. I think we are missing the point here. I feel that we were already at the precipice of a mental health crisis, and COVID pushed us. And COVID had the ability to go and sit in all the big crevices and gaps we had in the health field, and mental health is one of it. It's glaring, it's in our face kind of crisis, but are we really doing enough? I don't think so. And the example is, I think we always approach problems with a very Band-Aid kind of solutions, that let's just get over this right now. I think where the lifestyle medicine makes sense to me is that we need to bring prevention to mental health as well. We know that if taken care of, like things like nutrition, trauma, something very basic, right? You just go a few miles down, you have 1 in 4 children going hungry. And if they don't have the right nutrition, how are you expecting them to grow into healthy adults, right? But the trauma of social determinants, the trauma of where they are socioeconomically, how that's impacting their family structure, the violence they are exposed to, we are not taking that in account. So if we are not really looking at taking a step back and looking at where the gaps are, and we are just focused on let's just be done and do something. Another thing that concerns me, I do understand that we have the need for mid-level mental health care. I'm a big proponent of it, but not at the expense of not having enough providers, having enough psychiatrists. So the last I checked, Michigan, 33 counties don't have psychiatrists. And when we go to specialized, like child psychiatrists or geriatric, it's a scary scarcity there. So we have increased the number of medical schools, but we are not proportionally growing enough residency slots. Then the thing is, yes, we are kind of teaching and really have wonderful psychiatrists, future psychiatrists coming in, but we are not giving them sustainability. You have mental health parity and equity, but it's not being used in most of the states. End of the day, when I have done everything to keep my patients safe, provide the best care, and then you get the call that insurance is not going to cover their stay anymore, what do you do then? Or with the geriatric population, even as a state, we don't have enough resources for our geriatric population. What the best care I think we are providing to them is TV and Meals on Wheels, or a diet that's not really helpful or nutritionally complementing what they need. So to me, there are major gaps, but also we are at a point that even a little bit is welcomed. We are very ecstatic, like, okay, you are interested. At least we have caught your interest. So yes, in that way, yes, it's a teachable moment.
And have you also talked about the resources that are available are underutilized? Is that your view?
So what we see with when I say color of wellness, one thing is how the health disparities affect you, but how the implicit biases of the provider impacts you, how there is a trust deficit with the people of color and the systems. There's a trust deficit. And I understand why. When I look at the previous psych books and read like, oh, schizophrenia rate twice as high in blacks. But then when you see that the care is not being provided, you see that the black women don't get enough breast cancer screening, or the infant mortality rate is higher in people of color. You see this trust deficit then playing in different ways. So one way I see is that you have vulnerability, you are in crisis mode, but you don't want to utilize what's out there because you don't trust the system. And we saw that with 911. And I don't know how many people know that 911 came out of civil rights movement. And at that time, 911 was created to respond to the mobs, quote unquote, the mobs. And so 911 has this association with police coming in. And is that acceptable to most people? And now that's why we have now 988 crisis hotline, where you can call and a therapist responds, can help you de-escalate the situation, but can also help you connect. But the data is showing that even that's not being utilized enough.
So yeah, talk more about what 988 is and Avail to Prevail.
So when I realized, so 988 is Crisis Lifeline that is created by the federal level and state levels. Again, like I said, it's like instead of 911, you can just text or call 988 Crisis Hotline, and a therapist or somebody trained in mental health tools would respond to you and can not only de-escalate the situation at hand, but can also connect you to some resources. So what we see in suicide prevention, that even till the last 10, 15 seconds, the person who is about to do it is still hoping to be saved. And if there is an intervention that happens in that 10, 15 seconds, and so we already encourage the patient, like have numbers to call or go to a crowded place, somewhere that you can break the cycle of this thinking that you are a burden, you are not worth living, right? So that's where I think just 988 is simple to remember, easy to use, and we are seeing amazing results of it. They are trying to create more culturally appropriate and matching tools like Latino and Hispanic language services are available now, and they're continuing to evolve. But what I was concerned that the studies were coming out that for women of color, and especially South Asian women, suicide is becoming the leading cause of death in the group 15 to 25 years. To me, that was alarming, concerning, and of course, very personal. So A Will to Prevail is a campaign. I conceptualized that how do we create that awareness on that what mental illnesses are, but also identify the resources and encourage, build that trust that these communities who are in crisis can avail and utilize services.
And what are your healing circles?
So healing circles came more after the geopolitical conflict in Gaza. What we found that, so it's interesting that find this very common in most faith communities, but it is very integral to Islam. The concept of community and ummah is very central. And by that, what I mean is that it's kind of ingrained in you that you are not just one person, but you take care of yourself, your family, but the ripple effect is then you continue to take care of the community around you, and that's how you contribute to a healthy society. So healing circles was that it can happen anywhere in the world, but if we feel that Muslim community is under siege or is getting affected by a conflict, or right now, if you look at the statistics coming out of Gaza, one in like every 10 minutes, a child can be maimed, paralyzed, or killed. That, to me, as a mother, even if I don't think of it as a Muslim issue or anywhere in the world, if I heard that number, it would be hard for me to even breathe or eat or sleep. But as a community, as a ummah, and a good example I just used, I can repeat here, is think of it that the river flows through different countries, but in the end, it's the same river. When it is flowing through the different countries, they say this is ours, right? But in the end, it's one river. So wherever, and unfortunately, we are also seeing right now the Muslims have become really vulnerable. There is more Muslims dying every day in hands of terrorists or in the war against terrorism. More and more are being forced to flee their homes, become refugees or in exile. And my biggest concern is that there's almost a generation of Muslim kids growing that will have no country to call their own. So that's where the healing circle started. Idea always is to provide a safe space. And I know it is very heartbreaking and sad that forever I've worked towards interfaith bridging and peace. But I feel like when we kind of start talking about the wellness of one community, it is assumed that you are doing it anti another community, which is never the goal. We want everyone to thrive and come together, right? But I think healing circles came out of that concept that where you can feel safe, can speak up, can be validated, can be hugged.
Talk a little bit more about how what's going on in Gaza is impacting your work and why you feel Muslims tend to be unsafe talking about their mental health.
How much time do we have? Okay, how's Gaza impacting me as an individual? I think it is very concerning for me that even at this point in my life where I have selflessly worked as an American and have worked for America, but the hyphenated self always is, the label is put on me that you're Muslim American or you're Pakistani American. And lately, what we have seen is, and you won't see it in any other faith community or religion, that this is almost being used as a political jargon now, or even this has been weaponized against you, I would say. If we look at the bullying rates right now, the bullying rate for Muslim youth or kids in school is almost 2 to 3 times higher than the national rate. If we look at the hate crimes, they have quadrupled. If we look at physical violence, that has escalated. You asked me how I feel. How would you feel when you find out that a 6-year-old is multiple times stabbed because of his faith identity? On the other hand, and again, what faith has national laws against you? Like you have a law saying ban Muslims. How does that make you feel? Even I hesitate to use word Islamophobia because phobia is a fear against something that you consider dangerous. So, and phobia is something like something that can go away with exposure and desensitization. This hatred and prejudice is not going away. And another piece that I think we tend to forget is that anti-Semitism and anti-Muslim racism are two sides of the same coin. We are the same people. And it's usually not one creating hate against the other. It's always the third party trying to create this, turning this everything into a holy war, which it isn't not. So even if we look at Gaza, you have not only Muslim and Jews there, Jewish people there, you have Christian people, you have Baha'is there, you even have other religious groups there. So to me, we are doing a big disservice by turning it into that. But here, I think that what we are seeing is that the environment is being created that if you are saying something from even a medical point of view or from a mental health provider point of view, that if I'm saying what is happening there, I'm not against anyone. I'm just bringing focus on what is hurting me as a mother, as a provider. And if it was happening in Ukraine, I was the first few people to offer services. It didn't matter. But when you see the rhetoric that Ukraine refugees are educated because they are blonde and blue-eyed, and that somehow you are children of a lesser God. And we know in psychology we call this otherization. So when you start to believe that it's happening to the others, you become like, you have apathy. Like, okay, it's happening to the others, then others must be doing something to have this happen to them, right? Forever, as a student of history and philosophy, I was always wondered that how did we let Holocaust happen? Didn't Holocaust happen on our watch? But Gaza is showing me how apathetic we can get because it doesn't impact me, but it does impact you. And I give the example of HIV pandemic, that when it first came out, it was like, somewhere remote in Africa it happened. But in few years, it was on our doorstep, and then we wake up. COVID or anything, hatred, does not impact just the person that you're extending it towards, it also eats you up from inside. And I feel that the way things are going, so I call this the pea soup: phobia, politics, policy. So I think right now the pea soup that we are brewing is like a poison that is gonna affect the whole society. And with the coming elections, the divisiveness in the country is palpable. But we are not realizing how we all are contributing towards it.
So tell me a little bit about the cultural psychiatry curriculum.
So when I first immigrated and joined the psychiatry residency training program, it was very vanilla in flavor. And so I realized that it was very hard for me to feel part of it, but it was also hard for others to understand where I'm coming from. So when I realized that, and I started asking, and I realized that there was no cultural psychiatry curriculum in the program, or cultural psychiatry was being referred to or mentioned. Like, we all go through cultural competency every training, but it still was not doing what I wanted to do with it. And that's where I developed this cultural psychiatry curriculum. And I do like 6-7 lectures around it. But the idea is, first of all of us, we are not living in a vacuum. All of us are bringing our culture with us. It's the iCloud. I explained to the new generation. It's the iCloud that we carry. But we are also, our schemas of the mind, or the lens that we look at the world, is kind of defined by where we were born, how we were raised, who we were raised with, what is our belief system, tradition, song, food. But the thought process, how it affects our thoughts, is, and once you start with your individual awareness, but then you reach out to how you kind of coexist, the art of acceptance and learning to coexist.
You're the director of the Muslim Health Conference and Consortium. Tell us what that is.
So in my second year, American Psychiatric Association gave me minority fellowship. That gives you a grant. And to me, as a provider, mental health provider, what I realized, the deep stigma that was in the community. So Michigan, if you look at the census and a lot of literature, you would see it has one of the biggest Muslim population in the country, right? I think San Diego is the other, but Michigan is considered the capital in a way, Dearborn especially. So what I realized was that, yes, when I was in the community, they will walk up to me and take me to the side and whisper in my ear or mention the struggles their son, daughter, wives, whoever is going through. But when it came to when I would say, come to the clinic, they wouldn't show up. So I was like, where is this disconnect happening, right? Besides stigma, I talked about trust deficit, the fears that you had, that when you put this mental on a community that you have to be model minority, but then you are under political surveillance, that's a very lethal combination. First of all, to admit something is wrong with us. But if we admit we are wrong, you are going to turn this into a pathology and say that's what Islam teaches you and that's how Muslims are. Of course, there is a fear there. Then do I want to bring that shame? Or do I want to get myself into trouble or my community into trouble, right? So I was like, how can I best use these funds? And I came to the department and I said, I want to do Muslim Mental Health Conference. And it's very interesting. I got 2 emails when I first announced it. First of all, I'm so grateful for the department and my chair to support me through that, because there was a lot of fear at that point. You did not want to put Muslim in any title or any programming, but they supported me. But it's when I first announced it, I got 2 emails. So one email was from a faith leader, Imam. He said, how dare you put Muslim and mental in the same title? And the second email said, oh, I'm so glad you're fixing them. You're doing something about them. So that's exactly where I knew my work was. You want the faith leaders to be accepting that, yes, you have mental health concerns in the community, and praying is healing, but will not cure all mental illnesses. You need treatment. On the other hand, yes, not all Muslims are mental or have mental health concerns, right?
So we mentioned that you're a Cranes Detroit Business 2024 Healthcare Hero. We've also learned that the Greater Lansing United Nations Association is going to honor you with the Global Goals Local Leaders Award. Congratulations, and your thoughts.
I am humbled, and I'll tell you. I got 3 major awards in the last few months. And really, I went to ChatGPT and I was like, I need to find a more profound word than humbled. But in the end, I'm just grateful, very grateful to Detroit Cranes Health Hero Award and Greater Lansing United Nation Award. But how I always look at an award is that I feel like I'm being heard, that it's starting to matter what I'm saying. So more than an individual gratification or pride, it's a moment of acknowledgement of my work.
So, Dr. Abbasi, I've got you warmed up. Is there anything important I haven't asked you that you want to talk about, or just sort of summarize your thoughts for this conversation today? What would you like us to take away from this conversation more than anything else?
In the end, I am a big believer of bringing it back to my home, and my home is Michigan State University. I understand that there is a separation of state and religion, but not taking one individual's faith into account of their distress or healing is a misservice and to contributing to health disparities. That's one thing. Other thing is, when I talk of our color of wellness, I still feel that faculty of color and student of color are still struggling to find their place. I serve on the University Health Committee, and the research, that data that I was studying says that 50% people still feel they do not belong. That's a very high number. And I know our heart is in the right place. We are trying to do the right things. There's a lot of amazing people doing amazing work, and I don't want to take away from that. I don't want to minimize that. But I also challenge each one of us to go deeper. It's high time we don't take competency as checkbox. And we really need to go deeper into understanding how equity and inclusiveness means. Forever I have been told I do too much. And I know I'm doing too much. But why am I doing too much? Why don't I feel comfortable not doing or carrying this burden? Why don't I feel I can pass this burden on to someone? If I felt that enough was being done, if I felt that I am being understood, or if I felt that the policies are changing, then each one of us would not be carrying that heavy burden that in the end cost us in our health, our mental wellness, and does shorten our lifespans. But important piece, I think what I'm trying to say is Michigan State has the resources and the respect and integrity that doing more community outreach and having community collaboration, like bringing community stakeholders with the expertise that you have at Michigan State. You have trauma-informed care. You have wonderful psychiatrists, psychologists, teachers who are doing this work. But 9-8 is such an easy tool. I want, even with my residents, it should be part of our medical notes. It should be at every clinic. It should be part of our every teaching conversation. So definitely, I think even with medical students, I've offered to do 9-8 kind of seminars, and that's my hope with Avail to Prevail program. It's not just going to be restricted to one community or one minority community. I want to introduce it to everyone. So it's interesting. I come from Pakistan where the colors are green and white. So I think that's one of the reasons I've always felt at home. I'm still green and white. I still bleed green. But I think for most part, MSU and the Spartan spirit gets it. That's why so many of us get attracted here. But what's really meaningful for me always would be being a Spartan.
For more on Michigan State University's Dr. Farha Abbasi, visit drfarhaabbasi.com. DrFarhaabbasi, drfarhaabbasi.com. And I'm Russ White for MSU Today.
Find, rate, and subscribe to MSU Today with Russ White on Spotify, Apple Podcasts, and wherever you get your shows. And please feel free to share this episode if you're so inclined.
Thank you for listening to MSU Today.